Hi guys, so we are at page 312, Trail Guide to the Body, and we are featuring the biceps femoris, the semitendinosus, the semimembranosus, or it's so-called hamstring. Okay, so looking at the image 6.71 here, we have the posterior view, we have the semitendinosus highlighted, and here we have the semimembranosus highlighted. Okay, again, this is a posterior view. Okay, so what is the action of the biceps femoris? It does flex the knee or the tibiofemoral joint. It laterally rotates the flexed knee. Again, it has to be in a flex position. Okay, the long head extends the hip, and again, the long head assists to lateral rotate the hip, and it tilts the pelvis posteriorly. Okay, there's a big job of the biceps femoris. So the origin, okay, so we can see here the origin of the long head is at the ischial tuberosity. Short head is the lateral lip of the linea aspera. Okay, and then we have the insertion at the head of the fibula. Okay, and we have the long head as the sciatic or the tibial branch, L5, S1, S2, and S3, and the short head, the sciatic, the peroneal branch, L5, S1, and S2. So you have to know because there's two innervation, right? One goes to the tibial branch, one goes out to the peroneal branch. Okay, so we have established that. Okay, this is the head of the fibula. Okay, right, that is the insertion of the biceps femoris. Now we're going to move ahead for the semitendinosus. So the action is flex the knee at the tibiofemoral joint. We're going to medially rotate the flexed knee, and we're going to extend the hip. Okay, so we're going to assist to medially rotate the hip, and of course tilt the pelvis posteriorly. Okay, so pretty much they do have a lot of job or responsibility of the hamstring to do. Okay, so the origin is at the ischial tuberosity. Okay, here, and then we have the insertion at the proximal. Okay, medial shaft of the tibia at pes anserinus tendon. Okay, that's the semitendinosus. Okay, keep in mind it's at the pes anserinus tendon. Okay, and then nerve innervation and sciatic, which is a tibial branch, L4, L5, S1, and S2. Now moving on to semimembranosus, the action is flex the knee. It medially rotate. Again, if the knee is flexed, and extend the hip, and it assists to medially rotate the hip, and also it tilts the pelvis posteriorly. Okay, the origin is at the ischial tuberosity. Okay, you can see here. Okay, it's in the middle, basically where the three positioned, right? And the insertion is at the posterior aspect of medial condyle of tibia. Okay, and nerve innervation is sciatic nerve, which is a tibial branch of L4, L5, S1, and S2. See you guys on the page 313.